Welcome to the NCLEX Review, where I help you review all the things you need to know for NCLEX. If you would like a copy of the study guide, you can find it on my website, blossomwithjessica.com. Assessments, so regular kind of vital signs and lab values. So the first is our adult vital signs. Heart rate normally 80 to 100, respiratory 12 to 20, blood pressure 110 to 120 over 60, and temperature 98.6 or 37 degrees Celsius. Then when we talk about serum electrolytes, so how I remember these is first we have potassium. And when I think of potassium, I think of bananas. And when I go to the store and I buy a bunch of bananas, there is between 3.5 and 5 bananas in a bunch. And we want to make sure that we definitely remember potassium, because when patients are outside of the normal range, we can see cardiac irregularities. It's really pretty much the most important electrolyte to be monitoring. It's always our priority, so it's really important we remember that. So then when we talk about sodium, so when I think of sodium, I think of like fast food, burger places, like things that have a lot of sodium on French fries, like salt. I'm thinking salt, like salty food. So when you go to a place that has salty food, you're going to spend around $13.50 to $14.50. So I remember it as $135 to $145. So that's just how I remember it. But that's me. You might find a different way. Then calcium. So when I see calcium, C-A-L, I think call 911. It must just be the psych nurse in me. But when we call 911, that's very close to 8.5 to 10.5. So that's kind of how I remember that. Then we have chloride. So when I think of chloride, I think of chlorine and I think of a pool. And I personally only like to swim in a pool when it's really hot. So like 95 to 105 degrees, that's when I'll go swimming. So that's how I remember that one. Then we have magnesium. And I just kind of remember that that's 1.5 to 2.5. Again, you're probably not going to get a question about magnesium. If you're going to get a question about electrolytes, it's going to be sodium or potassium. And then phosphorus is 2.5 to 4.5. Now when we talk about blood values, red blood cells 4.5 to 5, white blood cells 5 to 10. Anything higher than this can indicate an infection. Neutrophils 60 to 70, lymphocytes 20 to 25, monocytes. I'm not going to read through all of these, but these are the labs you should know. The big ones, I would say, you're not going to get asked on NCLEX about neutrophils and lymphocytes and monocytes. You might get asked about red blood cells, hemoglobin or hematocrit, and white blood cells related to infection. All right, so then we have cardiac markers, and the things that are important to know about this is troponin is very important. You probably won't get asked about these other ones, but you might get asked about troponin in relation to an MI. Okay, and then acid-base balance. So when we're figuring out acid-base balance, and we'll go over this a little bit later, these are our normal values. Anything outside of this can kind of indicate a problem, and we'll go over how to do that in a little bit. But a normal pH is 7.35 to 7.45. Normal CO2 is 35 to 45. Normal HCO3 is 24 to 26. Our PaO2 is 80 to 100 and SaO2 is greater than 95. Those are our normal values. When it comes to chemistry values, again, these are our normal values for chemistry. Things that I would make sure you definitely know for NCLEX is the glucose value. So 70 to 110 is the normal. You probably aren't going to get asked anything on the rest of these. But you may, so they're good to know. But I would definitely know the glucose. Anticoagulation therapy. These I would know. You may get a question about heparin or warfarin or something like that. So PTT normal is 20 to 36 seconds on heparin. We want it to be 1.5 to 2 times the normal. Our PT 9 to 11 seconds, and an INR of 0.9 to 1.8, but 2 to 3 if on warfarin. And then our therapeutic drug levels. Things to know for NCLEX, definitely the digoxin, definitely the lithium levels. And I would say that's probably the need to know, but you have the rest of these here to look at as well. Then also vancomycin, I would note that one. Adventitious lung sounds. So the different types of lung sounds you might hear when doing an assessment. The first one is going to be crackles. So these are fine, short, interrupted cracking sounds. Alveolar rails are high-pitched. Sound can be stimulated by rolling a lock of hair near your ear. So if you take your hair and kind of crinkle it near your ear, that's the sound that crackles will be. It's best heard on inspiration, but can be heard on both inspiration and expiration, and can be cleared by a cough. The sound comes from air passing through fluid or mucus. Then we have gurgles or rhonchi. This is a continuous, low-pitched, coarse, gurgling, harsh, loud sound with a moaning or snoring quality. It's kind of the best heard on expiration. And this is air passing through a narrow air passage as a result of secretion, swelling, or tumor. Then you might hear a wheeze. So this is a continuous high-pitched squeaking musical sound. That's kind of the key. If in the question they're asking you about a musical sound, it's most likely going to be a wheeze. Heard on expiration, not altered by coughing. And this is air passing through a constricted bronchus as a result of secretion, swelling, or tumor. Then we have a pleural friction rub. This is a superficial grating or creaking sound heard during inspiration and expiration. And this is comes from rubbing together of inflamed pleural surfaces. Then we have stridor. This is a harsh, high-pitched, that's kind of the key word here, breathing due to obstruction in the upper airway. And again, that's from an obstruction in the upper airway. All right, so let's talk about conversions. These you definitely need to know. You may get questions about this on NCLEX related to medication dosing, fluid balances, if someone is on a fluid restriction, how many cups of something can you give, or weights, or all of those things. So important to know is, that one teaspoon is 5 mLs, 1 tablespoon is 3 teaspoons. This is important to know. You may get a medication question related to that. Also, other ones that are important, that 1 ounce is 30 mLs. That is important. That 1 cup is 8 ounces. 1 kilogram is 2.2 pounds. I'd probably say you should know that 1 gram is 1,000 milligrams. And those are probably the real important ones. I mean, maybe that 1 pound is 16 ounces. You might get something on that. And 1 milligram is 1,000 micrograms, or 0.001 grams. So make sure you know these, because you may get questions related to medication dosing. All right, so medication calculations. So the first one is going to be the amount to administer. So we want to take the dose and put it over what we have, and that's going to give us the amount to administer. So in order to do that, we're going to plug in, so X mLs, so the amount to administer, equals the unit dose over the unit concentration equals milligrams over milligrams. Then we can look at flow rate calculations. So to do this, we're putting the rate equals the amount of milliliters over per hour. And our drip rate equals the ordered volume times the drip rate over time in minutes. And then we have infusion time. So infusion time is the total volume to be infused over milliliters per hour being infused. And those are medication calculations. And I can make another video on medication calculations if you guys want to go more in depth with this. But again, this is just a review. So these are your medication calculation equations. All right, and if you would like a copy of the study guide, you can find it on my website, blossomwithjessica.com.